Julie Doherty is a chartered psychologist with experience in public health and palliative care research. Her recent work focuses on promoting quality of life and care delivery for individuals with life-limiting conditions and their carers. She has a particular interest in communication and shared decision-making on goals of care, community-based support, and implementation of interventions. So over to you, Julie.
Thank you, Stephanie, for that introduction. And the opportunity to come along today and speak to everyone about mixed methods. So, as Stephanie said, my name is Dr. Julie Doherty, and I'm a lecturer at Queen's University in the School of Nursing and Midwifery. And today I'm here to introduce you to mixed method research and its role really within palliative care. So I'm hoping that some people on the call are either engaged in mixed method research, or I can inspire some people today to participate in mixed method research moving forward in their careers. I feel that mixed method research is particularly relevant in palliative care because they can be complex questions that are deeply personal and really dependent on context and experiences. And I think that bringing together the mixed methods helps us understand the information more broadly as well. So you might hear me talk about mixed methods quite positively as we move through, of course, because that's the topic that I'm passionate about. So this session then is designed as an introduction, and it aims really to balance theory and practical application. So I do start with some broad information, and then I will talk about some of the work that I've been involved in and also some other literature that was available to illustrate how mixed method research is being used in palliative care. Okay, so just before we begin then, I'll briefly outline what we will cover. We are going to talk about mixed methods research, and I'll provide an introduction to that, why it matters in palliative care. I will discuss some of the mixed method designs and also touch on integration as well. And as I said, we will then progress to some research examples, both that I've been involved in and from the literature. And then I'll finish with some key takeaway messages as well. And of course, there will be time for a Q&A, and happy to take any questions through the presentation as well. So the first point I really wanted to make is the complexity of palliative care research, because I think this is why mixed methods really lends itself to research in this area. We know that there are various elements in relation to mixed palliative care. So for example, there's the clinical outcomes such as pain or quality of life, and they certainly can be measured using quantifiable tools. There's other aspects such as patients' experiences and family and caregivers' experiences, which could be measured with quantitative methods or could be measured with qualitative methods as well, to give that sort of richer and deeper understanding of experiences in relation to palliative care. And of course, then we have the care context, including the setting where the care is delivered, the multidisciplinary team, and the broader interaction with the health service as well. So those four elements really are interrelated in relation to palliative care. And mixed method research then is particularly valuable because it allows us to adopt that multiple approach to understanding these different elements. So we may have a study where we are looking at pain, for example, or comfort at the end of life. We may measure some clinical outcomes, and then we may also follow up with patients' experiences as well. And we bring that information together and integrate it, which is essentially the key component of mixed methods. It's not just about carrying out these two separate pieces, it's about integrating them in order to get a fuller picture or to better understand the research question that we would like to know about. So moving on to the next slide then. Why does mixed methods matter in palliative care research? And I have touched on this. I've touched on the idea that it can produce a broader and actionable understanding of the topic. And that's something that I feel quite strong about, is that I feel it does provide, in certain contexts, a broader understanding. Healthcare and palliative care can be quite complex, as we've mentioned, and one approach may not fully capture all the information or all the numbers or all the stories alone. So mixed methods really addresses this and integrates both. Different types of questions require different approaches. So although I am putting forward about mixed methods today, there are certainly some scenarios or questions that are better suited to quantitative, and there are others that are better suited to qualitative. But today is about mixed methods, so I'm trying to highlight how that can be a useful tool or approach to understanding palliative care. And of course, the ultimate goal is always to improve quality of life and care delivery for individuals and their families as well. So the idea is that we can triangulate this information. We can bring together these two different approaches that might give us some partial understanding to provide a fuller understanding. And the idea is that triangulation and that integration and bringing together of those different approaches can improve the credibility of the findings. It can also enhance the validity by combining strengths of both approaches. So again, it's back to this idea that there are limitations, of course, to quantitative research. There are limitations to qualitative research. But by combining both of these approaches to answer an appropriate question can address some of those limitations, and that in itself is a strength of the actual approach. So moving on in terms of mixed methods, it is the bringing together of qualitative and quantitative approaches within a single study. It's not about multiple qualitative studies within a project or multiple quantitative elements. The key point of mixed methods is to bring together the two methods and integrate them in one single study. So it's not simply doing a survey and a few interviews. It is more comprehensive than that. And it certainly then allows us to obtain different but complementary data sets, and then to integrate those to increase the validity of our work and the credibility of our work that I mentioned in the previous slide. So the key point here in terms of mixed methods is really that these approaches provide insights that wouldn't be possible with one single approach. That's essentially when you would engage with mixed methods, when you feel that one approach wouldn't provide the insight that you would like in relation to your topic or your research question. And of course, then we are collecting and analysing different types of data and integrating these to have a deeper understanding. So the first few slides was really just a broad overview of what mixed methods is and why it's relevant to palliative care. So what I was trying to do with those slides is really encourage everyone to think about their questions, their research, and whether or not two approaches, the mixed method approach, would be useful in that scenario. But there are, of course, lots of designs that we can use in mixed method research. Now, I have covered some of them, not all, on this presentation today, but I will walk through the 4 that I have included on screen. So convergent parallel design, an explanatory sequential design, an exploratory sequential design, and a multi-phase design. And quite often what we find is people get a little confused about the different types of mixed methods and what they mean in relation to their study and how to apply it. So hopefully, as we walk through these different mixed method designs, that clarifies how they're applied in practice. So the first design I would like to talk about is the convergent parallel design. And this design really is qualitative and quantitative data that's collected at the same time. They're collected in parallel. That's the way to think about this research design. And the results then are compared. So that process really supports the findings are compared to see whether they support or challenge each other. And if we try to work through an example in terms of what this might look like, we might have a question like, how do patients receive palliative care at home? How do patients who receive palliative care at home experience symptom management, and how effective are current treatments? So if we are thinking about a convergent parallel design, we might think about assessing levels of pain and fatigue or quality of life as part of our work. And alongside that, we might actually then collect that quantitative data, but hold an individual interview to learn more, to explore the experiences of symptom management at home. So really you can bring those two pieces, carry out those two pieces of research at the same time, and then bring them data sets together as well. So the research is carried out at the same time. They're analysed separately, but then they're brought together in terms of interpretation. So researchers might compare whether improvements or issues related to symptom management through the qualitative interview. So they may be able to learn about that. So we can understand their scores from this quantitative data, and then we can understand the factors that might be influencing that, or how they feel about their pain or their symptom management through the qualitative. And it gives just a completer understanding of symptom management for those receiving palliative care at home. So that's a bit of a broad illustration, perhaps, but we will talk about some real life research as we progress towards the end of the presentation. So in a convergent design, both types of data are collected at the same time. I suppose that's the key point. And the idea is to compare and contrast the findings. Do they align? Do they differ? So is their pain level reflected in the qualitative? Does that tell you any of the challenges that they're experiencing as well? So we will move on to the next design, which is an explanatory sequential design. And this differs because the research is not carried out in parallel. It begins with a quantitative data collection followed by a qualitative phase. So this design represents quantitative data followed by a qualitative phase, and it can help explain or expand the results. In this type of design, the study begins with the quantitative data collection. So for example, if we have family caregivers and we want to know about their satisfaction with care provided to their relative who is residing in a care home, we might administer a survey to determine satisfaction with care to family carers. The second step then, once we have that information, because it's not done in parallel, once we have that information, we can craft our interviews, or we can look at our interview schedules, and we can then arrange to carry out qualitative research to explore the views on satisfaction with care. What are the factors that's influencing satisfaction with care? What can we learn from these real world lived experiences to help us understand what their response was to the satisfaction of care survey? And I think What's really important in mixed method research is this is really set in the real world. We want to understand real world problems by applying both of these approaches. So understanding what individuals think about satisfaction or how they feel about the care, and then trying to get a deeper understanding of the factors contributing to that and exploring those views. And all of that information can come together and help inform change. So the integration then is about the qualitative findings really explaining or providing context for the quantitative findings. It's really helping to understand the why behind the quantitative findings. And we know that's the strength of qualitative work, can help you understand the why behind in relation to some of these topics. Okay, so I know we're going through a number of designs here, but I think it is useful to make the distinction between each of them because it is an area that can be a little confusing sometimes. So the next design really works in the opposite direction. So it's an exploratory sequential design. And this starts with a qualitative data collection component to understand the topic, and then insights from the first phase are used to create or refine a quantitative measure. So in contrast to the previous design, we are now starting with a qualitative data collection process in an exploratory sequential design and following that up with a quantitative measure. I put a little example on screen to try and illustrate this. So if we think about how we can support individuals with life-limiting conditions to engage with social prescribing, for example, it's a relatively new topic. There's not much known in terms of how people are engaging with social prescribing in relation to how can we support people to engage with social prescribing. So it is a relatively new topic, and that is why this exploratory approach would be quite appropriate, but also it allows us to build from the qualitative phase into a quantitative phase. So an example would be carrying out interviews or focus groups to understand barriers and facilitators to engagement with social prescribing. And then we can use that information, particularly if we have a theoretical framework as well. And we can develop a questionnaire. And this is something that I've actually done recently with one of my students. We carried out a large qualitative study and we used that data to then construct a questionnaire, which was administered then to a larger population to understand the factors that influence engagement as in social prescribing. So it really allows the topic to be explored or measured more broadly, but in a different way to the exploratory or the explanatory design. So to summarize this approach, it's qualitative methods followed by quantitative, and the qualitative method informs the quantitative aspect as well. So I hope that example does illustrate that design for everyone. The last mixed method research design that I would like to touch on, and it's one that I would use quite often as well, involves phases of qualitative and quantitative data collection. So really the different phases build on each other to create a more complete understanding. And the reason I find that I use this quite often is because I can be involved in intervention development, and there can often be a multi-phased approach to this type of research. So you can see from the example that I've provided that this approach can relate to an intervention. So how does the family care decision support intervention support family carers involved in decision making at end of life? So this was a piece of work that I was involved in, and it was much more complex than maybe the table suggests on screen, but I'm trying to illustrate how the multiple phases are integrated into the palliative care research. So, for example, we carried out interviews with family carers and healthcare professionals. We wanted to understand their support needs and also barriers and facilitators to implementing an intervention. And we wanted to know that prior to delivery. Then the intervention was implemented and we collected quantitative data. So, for example, we assessed or we collected information on family carers' decisional conflict. So that's a standardized scale that gave us some insight into decisional conflict in family carers who are involved in end-of-life discussions. And some other quantitative data may have involved the number of advanced care plans, for example. The qualitative phase included a process evaluation. So in intervention work, it's important to understand the how and the why of the intervention. So the process evaluation can really help us understand that and understand people's experiences of it. And it can also expand upon the quantitative information that we collected. So if, for example, it did reduce decisional conflict, we can learn a little bit more about how the intervention worked and had that impact. In this study, the qualitative and quantitative phases, and there were 2 qualitative phases, for example, and a quantitative phase, that information then was integrated together. So it was analysed separately and then integrated together in a cross-case analysis where we created a matrix for that data analysis process. So a multi-phase design really does allow the researcher to explore and develop and test interventions over multiple stages, or certainly this is the way in which I've used a multiple phase design in the past. So I have covered some of the designs and mixed methods. I just also want to briefly then talk about integration, which I have covered, but I've covered it in relation to the analysis really. But what I want to highlight in this slide is really the interconnecting parts of mixed methods research is that really your mixed methods, you should be considering it at the design stage and planning for it, at the data collection stage, and ensuring that your mixed method approaches appropriately in your analysis stage, thinking about how your mixed methods are integrated together, and then in the interpretation stage, how your mixed methods come together and then your interpretation of that information in that approach. So I just wanted to highlight while mixed methods are the integration is related to the analysis, it is actually quite important across the full design of a study. So some of the types of integration that can occur, and the real value really comes from the different types of integration, and often we use triangulation. So if you're familiar with mixed methods, you might be familiar with this type of integration, and that's really about cross-checking results to collaborate or corroborate findings. Whereas complementary approaches are really strategies that allow us to look at different aspects or elements of the same topic, but producing a fuller picture. So triangulation looks for agreement in the data. Complementary adds depth. And I think those approaches are reflected in the designs. Development, if we are integrating in terms of developing, then we're using the results from one method to inform another, for example. And then in terms of expansion, we're maybe using qualitative research to explore processes and quantitative research to assess outcomes. So for example, in the intervention work that I mentioned. The next slide highlights some of the practical considerations in mixed method research. So I understand that actually adopting this approach means you have to have an understanding of both quantitative and qualitative research. So it is important that we justify the approach, I think, as well. Is mixed methods justifiable? It's important to give some consideration to whether or not it is the most appropriate approach. So it should be driven by the research question, and you should consider if both approaches are necessary. Based on some of the things I've talked about to date in this presentation, that might help you think through, would mixed methods be a justifiable approach or the best approach to this research question or topic. Have you considered the timing and the sequencing? So you can see from the research design that the sequencing is important, it has implications. And have you considered the timing? Because depending on your approach, then it's important to give time to carry out both elements. So that's something to factor in your work as well. And how have you planned for integration? So I would always advocate for ensuring that you've planned your mixed method approach throughout your project, and establish this particularly to ensure that the data sets will be integrated during the analysis and interpretation, because that's where the learning happens as well, through that integration process. We of course have a number of benefits and challenges, and again, like the last slide, I think it's important to give a balanced view. In my opinion, the benefits really outweigh the negatives, because it really captures both the measurable outcomes and experiences. It gives a fuller picture and really addresses some of the limitations of using individual approaches. But again, it does come back to your research question and ensuring that the approach that you adopt is the most appropriate. I think it can give a stronger evidence base because it addresses limitations of each approach, and it can help improve intervention design and implementation. So if you are interested in intervention design and implementation, a mixed method approach is really useful there as well. Some of the challenges I've touched on is around time consuming. I think, in research design, we of course plan for that. So it's about acknowledging the different elements. It requires the knowledge of both approaches, so there is the need to be skilled in both approaches. And people do find the integration element difficult and how to go about that, the procedure for going about integration. So there are some challenges to mixed methods as well. So the last few slides I would like to share with you is some of the research that I've been involved in, that I've touched on, and some research that I found in the literature for the purpose of illustration today. And the first one is a mixed method study that was known as the Family Care Decision Support intervention. So this is an example where it was a clustered randomized control trial. It was carried out in nursing homes across Europe, and people with advanced dementia and their family caregivers were involved. So essentially, the Family Care Decision Support intervention was designed to support communication and shared decision making on end-of-life goals, and to help family carers in that process, because individuals with advanced dementia, for example, as we know, there is consideration that needs to be given in terms of capacity and best interest processes, and family carers play a huge role at that time in their loved ones' lives. So it's really important that they felt supported as well. So that's where this project really sat. And it was about training nursing home staff to deliver and facilitate conversations about end-of-life goals. It included the Comfort Care booklet, which is an information resource for family carers. And then it brought the training knowledge along with the Comfort Care booklet. Individuals were then asked to facilitate a family care meeting or a conference in the nursing home with the family carer. And the idea was to help them understand the risks and benefits of different treatment options, and also then decide or discuss if there was any changes to their advanced care plan, for example. So there were a few different elements to this project, and there were also a number of countries involved. So Ireland, United Kingdom, the Netherlands, Italy, Czech Republic, and Canada were all involved in this. So as part of the project then, if we think about that, the mixed methods angle, we did collect quantitative data. So we did look at we did use the decisional conflict scale, for example, and we did measure that quantitatively. We also looked at perceptions of care, so we measured that quantitatively, but we also carried out a process evaluation, and that really helped expand or help us understand the findings from the other element of the project. So they talked about how it provided reassurance and relieved concerns, and that's where maybe a reduction in decisional conflict occurred. But it also helped to develop those trusting and supportive relationships that we know are so important between healthcare professionals and families and residents as well. So I have put this on screen because I wanted to highlight that although it's an intervention project, it had mixed methods embedded within it, and those mixed methods were brought together and integrated at the end to give a fuller picture of the findings as well. This project has developed into another piece of work known as the In Touch project. This is led by colleagues at University College Cork, and it brings together what's known as In Touch daily sessions. So daily sessions are there to support comfort and connection through sensory activities, and also then what's called comfort care planning, which is the intervention that I just mentioned, the family care decision support intervention, is being embedded within this new project known as In Touch. And that again is to support families with shared decision making and the end of life goals or future care needs. It's being implemented across 7 countries as well, and there is a mixed method approach being adopted in this study. So for example, one of the main outcomes is comfort and agitation, and then there's also an embedded process evaluation that Queen's University are leading on as well. So it's another example of a large-scale project that is called mixed methods embedded within it. The final slide, or we're coming on to the final couple of slides, is some research I picked up from literature, and I just wanted to highlight them because they are different approach to mixed methods. So for example, if we look at the communication of palliative care needs and discharge letters from hospices provided to primary care, this was a study that adopted an explanatory sequential mixed methods approach with quantitative research followed by qualitative research. So if anyone is interested in looking at some mixed method papers, this one then is one that you might want to look at. So it talks about frequency of results and then the focus groups discussions as well. And they talk about how they triangulated that data. The next one is about examining public knowledge and attitudes and perceptions towards palliative care, and they also used a mixed method sequential design. So similar to the first, they had a cross-sectional survey followed by interviews to determine their knowledge and perceived acceptability. And again, it's worth looking at some of those papers if you have time. The final one then is a mapping exercise. So there's lots of different ways in which mixed methods can be used. And it's a mapping exercise where patients' perceptions and a verbal communication on end-of-life needs was explored using a mixed method approach. And they used a qualitative project and then quantified that information as well. So they have adopted a mixed method inquiry in this research project. So as we come to the end of the presentation, I just wanted to maybe come full circle and say mixed methods really is about integration of quantifiable, quantitative and qualitative approaches. It's ideal for research questions in palliative care for the reasons that I've explained, but the design choice depends on the research question, so you have to have some understanding of the design choice. But the main positive for me in terms of mixed methods is really the broader understanding of the context that in palliative and end-of-life care that it can provide. So that fuller picture, that broader understanding that's really important in relation to palliative and end-of-life care research. So thank you all for listening. I hope some of the information is of use today, and if anyone wants to reach out at any time, I'm happy to take questions.
Perfect. Thank you so much, Julie, for an excellent webinar. That was